Have you ever wondered what really happens when you stress your body to heal it? In recent years, we've seen celebrities invest millions in therapies promising rejuvenation, accelerated recovery, and enhanced performance. Some of these are incredibly expensive, almost futuristic. But here is something most people do and explain clearly: the mechanism behind many of these biohacks is actually quite simple. You apply controlled stress to the body to activate its own internal systems of adaptation and regeneration. The body isn't repaired from the outside in, it reorganizes from the inside out. These therapies just press biological switches that are often dormant. Today, I'm going to break down some of the most popular strategies with clinical honesty. I'll explain what worked for me, what had little impact, and what you can replace with far more accessible alternatives. Let's start with peptides. Peptides are short chains of amino acids that act as messengers, sending instructions to the body. Athletes use some for muscle recovery, while others explore them for chronic injuries or inflammation. My goal was to address osteoarthritis that had built up after years of microtrauma from sports and repetitive impact. I used two different types, one focused on tissue regeneration and improving local blood flow, and the other on immune modulation and inflammation control. What I observed is something many people report: the results are highly variable. Some describe significant improvement, while others notice little to no effect. Why is that? Because these substances don't replace the body's fundamental behavior. They send signals, but tissue only reorganizes if there's also adequate mechanical stimulus, proper nutrition, and a reduction in chronic inflammation. Interestingly, what made the biggest difference in my joints wasn't an injectable compound. It was something much simpler: myofascial release combined with deep facial stretching. Fascia is this continuous web of connective tissue that surrounds our muscles, organs, and joints. When it loses mobility, joint pain can increase, even if the joint itself isn't severely degenerated. After I started a nightly facial mobility routine before bed, the stiffness consistently decreased. Alongside that, some basic nutritional adjustments made a real difference. I increased my omega-3 fatty acids, completely eliminated refined seed oils, and prioritized anti-inflammatory nutrients. This experience really highlights an important pattern: sophisticated interventions do not compensate for neglected fundamentals. If the basics aren't in place, the fancy stuff won't work miracles. Now, let's talk about something even more advanced: stem cell therapy. The concept is biologically fascinating. Stem cells are these undifferentiated cells that can transform into different types of tissue. In theory, they can help regenerate damaged structures. There are various clinical approaches. Some use cells from the patient's own fat tissue, while others rely on external sources. The procedure is invasive and, in many cases, extremely expensive. The promise is huge: to reverse chronic inflammation, repair cartilage, and restore mobility. The success stories you hear are compelling, but individual response varies significantly. In my case, there was partial improvement, but it wasn't proportional to the financial investment or the intensity of the procedure. Plus, the recovery takes time. You often deal with local inflammation, discomfort, and temporary limitations. This raises a critical question: is there a way to stimulate our own endogenous stem cells without invasive procedures? The answer is yes. Prolonged fasting, especially structured protocols of around 72 hours done under proper supervision, has been shown to activate regenerative processes. This includes increased stem cell activity and enhanced autophagy. Autophagy is the body's natural process of cleaning house. It removes damaged cellular components and recycles internal structures. This process is fundamental for cellular longevity and reducing systemic inflammation. It's important to understand that when your goal is regeneration, the body must enter a conservation and repair mode. This isn't compatible with excessive, intense physical activity during the fasting period. Strategic rest actually amplifies the biological effects. This is a crucial distinction between fasting for weight loss and fasting for deep metabolic repair. A pattern is definitely starting to emerge here, isn't it? The most expensive therapies often just replicate something the body already knows how to do, if only it receives the right stimulus. We're often sold complex solutions when simple, fundamental habits hold the real power. By understanding these biological principles, you can take control of your health in a much more effective and accessible way. Thanks so much for watching. If you found this helpful, be sure to like this video and subscribe for more deep dives into health and performance. See you in the next one. Activating ancient survival mechanisms to trigger regeneration. If there's one common principle behind so-called extreme biohacks, it's this: the human body evolved to survive scarcity and environmental stress, not constant comfort. When you manipulate oxygen, temperature, nutrient availability, or hydration, you're activating ancient biological programs. These survival pathways were essential for human resilience long before modern technology existed. Let's start with oxygen manipulation. There's a method called intermittent hypoxic-hyperoxic training. The process involves exercising while wearing a mask connected to a system that alternates between reduced oxygen and elevated oxygen levels. In practical terms, you briefly simulate high-altitude conditions and then flood the body with oxygen. What happens physiologically? When cells experience temporary oxygen deprivation, they activate adaptive responses. Over time, this can stimulate new capillary growth, improve mitochondrial efficiency, and enhance the body's ability to utilize oxygen more effectively. This kind of stimulus may improve performance, accelerate recovery, and even reduce inflammation, since inflamed tissues are often poorly oxygenated. But here's the critical point: if intensity progresses too quickly, it can trigger excessive immune activation. Adaptation requires gradual exposure. And importantly, you don't need a $10,000 machine to trigger similar adaptations. Structured interval training and affordable respiratory resistance masks can stimulate comparable responses when used properly. Now let's talk about ozone therapy. Some protocols involve drawing blood, exposing it to ozone, and rainfusing it. The concept is controlled oxidative stress to stimulate internal antioxidant defenses and potentially support immune activity. Again, the central theme is adaptive stress. But what many people overlook is that exercise already creates controlled oxidative stress. Sauna exposure activates heat shock proteins. Cruciferous vegetables support liver detoxification enzymes. Fasting enhances cellular recycling mechanisms. Your body already has a powerful detoxification system. It simply needs the right triggers. Now we move into one of the most controversial interventions: dry fasting. Dry fasting means no food and no water for a defined period. The immediate reaction for many people is concern, and that's understandable. Done improperly, it can be dangerous. But what happens biologically? When water intake drops significantly, the body increases fat oxidation. During this process, metabolic water, sometimes called biological water, is produced internally from fat breakdown. This does not mean hydration isn't important. It means the body has compensatory mechanisms under specific, controlled conditions. The stress response activated during dry fasting turns on survival genes that are rarely stimulated in the modern environment of constant intake and convenience. However, this is not a casual experiment. It requires caution, gradual adaptation, and ideally medical supervision. Now let's discuss one of the most accessible interventions with powerful neurological effects: cold exposure. Ice baths, cold plunges, or even cold showers immediately activate the sympathetic nervous system. The body must maintain core temperature. To do that, it ramps up heat production through mitochondrial activation. This acute energy demand increases alertness, improves mood, and enhances mental clarity. Repeated cold exposure has also been associated with improved insulin sensitivity, better inflammatory balance, and enhanced metabolic efficiency. The most noticeable benefit for many people is cognitive. Focus sharpens. Mental fog decreases. Mood elevates. And you don't need extreme temperatures to begin. Gradual exposure, starting with brief cold showers, is enough to initiate adaptation. When you look at all these methods collectively, one pattern becomes clear: none of them are magic in isolation. They work because they force adaptation. The human body becomes extremely efficient when it's too comfortable. It conserves energy. It minimizes output. It stabilizes. Introduce calculated stress, and it reorganizes metabolically. But here's the most important principle: adaptation is dose-dependent. Too little stress produces no change. Too much stress overwhelms the system. True biological optimization is not about the most expensive therapy. It's about understanding the core triggers: temporary restriction, thermal variation, respiratory challenge, structural mobility, anti-inflammatory nutrition, and strategic recovery. Technology can amplify these effects. It does not replace the fundamentals. If you want real regeneration, start with the basics applied consistently. Then, only if necessary, consider advanced tools. Your body already knows how to repair itself. It just needs the right signal, at the right intensity, at the right time.